Hi everyone. Today my topic of discussion is the forearm bone, that is known as the radius. Now you see the radius, it is the lateral bone of the forearm. Always remember, this is a very confusing because we know in the forearm there are two bones. The lateral one is the radius and the medial one is the ulna. Now the lateral means the thumb is on the lateral side in this position. So always think towards the thumb, the bone is towards the thumb, that is the radius. Now how will you identify this bone? You will see it has got a smaller upper end and broader lower end. And you will see the upper end is identified by circular disc-like head, and whose you will see that this surface, the upper surface is concave, and you will see there is a constricted neck. This part is the constricted portion, and below that constricted portion you will get a rough area which is known as the radial tuberosity. Next you will see the lower end. What is the look of the lower end? In the lower end it is broader, and in the lower end there are 5 surfaces. What are the 5 surfaces you will see? You will see there is the flat lower part which is a bit concave, and this is the anterior surface. Now the posterior surface. How will you identify the posterior surface? You will see the posterior surface is marked by grooves and the ridges, out of which the middle ridge is very prominent, and this ridge is known as dorsal tubercle. You can feel here the dorsal tubercle. Next, this is the posterior surface. Next you will get the lateral surface. You will see the lateral surface here. It is rough. If you feel, this is rough and it is projected downward. So this projection is known as the styloid process of the radius. You will see the styloid process of the radius is here. You can feel the styloid process of the radius. Everything you will know by palpating your body. So this is the styloid process. You will see this styloid process is lower than this styloid process, that is the medial side bone is the ulna. So the shape of the ulna process, you see how small it is, and here the styloid process is much larger. So this is the lateral surface. Next, the medial surface, you will get a concave facet, and this facet will articulate in a small head present in the lower end of the ulna. This is known as the head of the ulna, and you can palpate the head if you flex your hand like this way. This prominence is known as the head of the ulna, and forming a joint which is known as the inferior radioulnar joint. Next you will see the upper end also, the similar, the tuberosity you will see here and the facet is here. So this is the medial surface. Next you will get the inferior surface, or which is the 5th surface. So this is the inferior surface. In the inferior surface you will get there is a transverse ridge, and this ridge divides into lateral portion, lateral facet, that is the shape is triangular, and this articulates with a bone which is known as the scaphoid. I will show you this bone. This is the boat-shaped bone. This boat-shaped bone is known as the scaphoid bone, and the medial portion articulate with this portion articulate with here another bone that is known as the lunate. So this is the scaphoid and lunate. So this part articulate like this. So forming a joint which is known as the ridge joint. Radiocarpal or wrist joint. You know, wrist joint, we are moving different types of movement. There is dorsiflexion, there is the palmar flexion, there is adduction, there is abduction. So all these movements occur in this region. So the carpal bones, you will see, for better movement, these bones are so segmented. So we finishes the lower end of the radius. Now come to the shaft. So the whole thing is the shaft, and this shaft, there are 3 borders and 3 surfaces. What are the different border? One border starts from the rough part of this tuberosity, that is the radial tuberosity. It forms a oblique line. You will see there is an oblique line, and then it is continued downwards and an anterior border, and which it ends in the styloid process of the radius. So the upper part of this line, that is the, you see, the anterior line is oblique, and it is known as the oblique line. You will see this is the oblique line. And you will see from this oblique line a muscle is attached. What is the name of the muscle? Flexure digitorum superficialis. That means it is the superficial muscle of the forearm. If you flex this digit forcefully, then you will palpate this muscle. So this is the flexure digitorum superficialis. Next, below that, the anterior surface is concave, and from this concave portion another strong muscle is attached, and name of that muscle is known as the flexure pollicis longus. So I will make you the flexure pollicis longus. So the muscle attached here, this is the flexure pollicis longus, very strong muscle. That means flexure of the pollax. Pollax means thumb. So thumb is a very strong. You hold everything by means of thumb. So this is the powerful muscle, that is the long flexure of the thumb. This is the flexion movement of the thumb. So this is the flexure pollicis longus. And in the lower part, a muscle is inserted, and the name of the muscle, that is the quadrate muscle, that is known as pronator quadratus. So pronator quadratus is inserted below. So you will see this is the attachment of the pronator quadratus. This is the attachment of the pronator quadratus, and other end attached to the ulna. So this finishes this anterior surface that lies between the interosseous and the anterior border. Interosseous border is sharp and it is placed medially. Next, you will see there is another border which situated posteriorly, and this border, its middle part is more prominent, and this middle part is prominent. This is the posterior border and ends in the dorsal tubercle. So in between this actually posterior border and this anterior border, this surface is the lateral surface of the radius. So in this lateral surface, in the upper part, you will see a muscle is inserted, that is known as the supinator. So in the lateral surface, you will see there is the attachment of the supinator muscle. That means the insertion. In the examination, if you forget this, which one is insertion, is which one is the origin, no problem. because muscle acts both from the origin and both from the insertion. So at that time you will tell there is the attachment of supinator, not insertion. So you will see this is the attachment of the supinator, and this rough area, that is the radial tuberosity, it gives attachment to a strong muscle tendon which is known as the biceps brachii. So you will see this tuberosity gives attachment to a tendon of a muscle. The muscle is known as biceps brachii. It is not prominent in case of female, but it is more prominent in case of male. And you will, if you bend your elbow, each of you feel, you will see there is a tendon, heart tendon, and this is the tendon of biceps, and that is inserted in this region or attached here. So by the contraction of the biceps there is flexion of the elbow joint. You notice. Another important of the biceps is that you feel the biceps because medial to the biceps there is an artery, that is the brachial artery. You feel the pulsation. After feeling the pulsation, you will actually round the cuff of the blood pressure here, and then you can know how will you record the BP. So this is very important tendon, biceps brachii. Next thing you will see in the head. In the head there is the depression, you will see here. So this depression, it gives attachment, not attachment, it will articulate with the capitulum, that means small head. That's why it is known as the capitulum. Capitulum of the humerus, forming the humeroradial part of the elbow joint. So the elbow joint consists of two parts. One is the humeroradial part, another is the humeroulnar part of the elbow joint. So this is very important. And the neck is and also this margin of the head is surrounded by ligament, and that ligament is actually, you see here there is a ligament that is known as the annular ligament, and this annular ligament attached in this fashion. You will see this forms the radioulnar joint, superior radioulnar joint, which is surrounded by this annular ligament. You will see in case of child what will happen. Here there is the cartilage. The bones formation starts from about 6 years of age. So before that it is a soft structure, and when some mother or parents, actually what happen, there is any water logging is there, they pull their baby by means of their hand, and suddenly there is dislocation of this superior radioulnar joint, and that is known as the pulled elbow. The person or the baby cannot move his hand this way. That means this is known as the pronation. That means king pronate, that means kings give something to somebody and beggars supinate. That means the beggars always taking from somebody. So this is actually the so that you can remind which is known as supination and which is known as the pronation. So this finishes the upper end of the radius, and the lower end I have already told you. And in this posterior surface, apart from supinator, the other structures are attached. So it will remember during the reading of the ulna. So how will you hold this bone in anatomical position? Now in anatomical position, the bone must be vertical, and you will place the bone in such a way that the upper end is identified by means of discoid head, then the constricted nape and the tuberosity. Lower end is identified by the broader lower part, and also there are rough ridges and the dorsal tubercle. So you identify the lower end. The medial border is very sharp. So medial border you kept it laterally. So in this way you can hold the bone in anatomical position. So thank you everyone.